Kenya, located on the east coast of sub-Saharan Africa, has economic potential. However, structural problems such as poor health care and gender inequality prevent the country's development. This lack of development has impacted Kenyan health, especially in the case of HIV. Gender inequalities largely contribute to the spread of HIV to both women and men in Kenya. The Kenyan healthcare system has been unable to provide affordable and accessible HIV care to those who need it and is unable to spread sufficient awareness about HIV. These factors all contribute to the fact that Kenya is ranked fourth in the world for percent of people living with HIV. Our organization, the Kenya Development Program, is requesting a grant of $5 billion in order to implement a 5-year plan to lower HIV infection rates and improve treatment for people already infected with HIV. We aim to do this by providing supplies for HIV prevention and treatment, educating the Kenyan population about HIV, and teaching women skills that will empower them economically. With this, we envision a world where HIV no longer dictates Kenyans' fate and where Kenyan women do not have to consider their gender a risk factor for HIV. The first step in fighting HIV prevalence rates in Kenya is the distribution of free antiretroviral drugs and condoms to infected and high-risk Kenyans. 20% of the population is still left without any access to any kind of HIV treatment, mainly in small rural towns. We aim to target that 20% for the following 5 years. In addition, we will provide free condoms to the infected Kenyan population in order to further reduce HIV sexual transmission rates. First, our organization will identify pharmaceutical companies where we can purchase generic antiretroviral drugs in bulk, and then we will create distribution centers in areas that have no access to treatment and contraceptives. We estimate that the 20% of the untreated Kenyan population will require a total of $3.8 billion of treatment with generic drugs over the 5 years. As for the distribution of condoms, only 40% of Kenyans who had 2 or more partners in 2014 reported using a condom during sex. To increase these percentages, we will purchase $250 million worth of condoms from a U.S. condom company over the duration of our program. Our second objective is to build 100 new clinics across Kenya, with the majority in rural towns, to distribute these supplies. We estimate that building 100 clinics will cost approximately $5 million. With this, we anticipate the number of people with access to HIV treatment in Kenya to increase and the number of HIV-related deaths to decrease over the 5 years. We anticipate a possible risk of this plan could be people without HIV taking the free drugs to sell elsewhere. We would mitigate this risk by creating screening programs to verify that the patients have HIV before getting the drugs. The next part of our organization's plan involves educating Kenyans about HIV, how to identify the disease, and how it is contracted. 36 to 46% of Kenyans are uneducated regarding HIV or AIDS. We will spread awareness about the symptoms and contraction of HIV by hiring professionals to lead information sessions for local Kenyans in the community. The educators can travel from already built clinics in urban areas to the clinics that we will build in rural areas. With this new information, the Kenyans could avoid spreading the disease and know how to proceed if they may have it already. Through teaching HIV transmission, we will be able to educate the population about prevention methods such as practicing safe sex, not sharing needles, and more. Over the next 5 years, our organization plans to train these community HIV experts to establish centers to learn about HIV. The education programs will also take place in the clinics we establish for the HIV drug distribution. We estimate staffing these 100 clinics will cost $325 million over 5 years. We anticipate the language barrier to pose a potential risk. However, professionals fluent in various languages will hopefully mitigate this risk. In order to address the HIV epidemic in Kenya, we must recognize the gender disparity associated with it. Kenyan men have an infection rate at 6.3%, while women have an infection rate at 8%. Economic inequality and established cultural roles largely contribute to women's higher risk for contracting HIV. While agriculture creates 80% of the jobs in Kenya, women have to work the majority of these jobs, which have no formal income, consequently making women economically dependent on men. Because of this dependence, men often have more freedom to have multiple sexual partners while still having unprotected sex with their wives, consequently increasing the spread of HIV. As a result, married women are almost twice as likely to have HIV compared to unmarried women. Our group intends to empower women economically by teaching them skills that will give them a better place in the workforce. We will identify which skills are useful for each targeted area and send international specialists to each area to teach the specific skills to the women. Teaching can include anything from beadwork and candle making to medical assistance. Roughly $610 million will go to paying specialists to teach women in each of the 100 clinics for 5 years. A potential risk for this solution could include men forbidding their wives and relatives from attending the training sessions. By empowering women economically, they will have a greater voice regarding their own health and the spread of HIV. Overall, in order to create a world where HIV no longer dictates the lives of people all over Kenya, we request a grant of $5 billion. With this grant, we will effectively distribute free drugs and condoms, educate the population about HIV, and empower women economically